Good evening to everyone present here. I cordially welcome you all to TechBharat 2021, Empowering EduTech and Health Tech. TechBharat is an initiative of Lagu Udyog Bharati, Karnataka, and IMS Foundation. TechBharat is envisioned as a platform to support startups and SMEs and be a guiding light to them in navigating their entrepreneurial journey. We welcome you to this session on support to startups in healthcare technology. Healthcare in India needs to become innovative and affordable. Challenges like accessibility and affordability continue to pose questions. Healthcare entrepreneurs are increasingly coming out with innovative and path-breaking solutions to achieve equitable and quality healthcare. What challenges do these startups face, and how can the ecosystem support them to ensure they succeed in their endeavor? To discuss this further, we have with us Mr. Chandramouli, CTO of Shankara Netralaya. He would be moderating this session. We thank you for accepting our invitation to moderate the session, sir, and welcome you.
Thank you.
We have with us Dr. Mrityunjay Sar, CEO of Technology Business Incubator at the Kalinga Institute of Industrial Technology, Orissa. He is also the founder director of School of Biotechnology at KET University. A very warm welcome to you too, sir. We also have Mr. Vijay, MD of Helixon Healthcare, an award-winning healthcare company based out of Chennai. Helixon, through the use of technology, data science, and automation, are building cutting-edge products for healthcare providers and consumers. We cordially welcome you to this session, sir.
Thank you.
I now request Mr. Chandramouli to take over the session and moderate it. Over to you.
Thank you, Vishnu. Warm welcome to everyone. Let me first start with Dr. Mrityunjay. I think pretty illustrious when we looked into what you have done over the years and also guiding many people, many startups. I also heard from you, some of it is becoming a unicorn in its own way out of a remote place, something like Bhubaneswar, which we have not even acknowledged that this could be done. I think great work, Dr. Mrityunjay. So I'll just make it a little more easier, simpler, conversational, rather than being that much more structured, formatted, so that we will be getting the benefit of your wisdom and your years of experience and so on, actually. See, I understand that you are heading the incubation program. You have been successfully doing it with many people. And you just wanted to prick your brains to understand, what exactly is bringing innovation in your incubation in the first place. And what do you see as a key trends, actually? Because this is something very, very important for us as a healthcare startup journey that we were trying to address the crowd. And more so, post-pandemic, this is becoming a new norm, actually, more than anything else. So how do we benefit from the wisdom of your collective advice to many people, actually? So we may like to hear from the horse's mouth.
Thank you. I may request others to mute probably. So thank you, Chandramouli sir. Thanks to TechBharat for inviting me to this platform. Let me tell you very briefly that you have asked what kind of things you have been doing, and we are partly successful here. And so 2009, we started this technology business incubator, and to be very honest with you, nobody was known. They were never known about what TBI means. So I approached, and the ministry gave us, and then the journey started. And from there, today, we have been a center of excellence, and I'll tell you very briefly what you have done. So the most important part I realized as a scientist that yes, we have been doing quite good in publishing papers, and can we bring a team, which I may not do alone. Can you bring a team, and then you start building those science into technology and then to enterprise level? So that was I think what KTBI did, bring the concept, the flavor of team building, which is not probably happening in many of the country, because incubator became the project. For us, incubation is a process. We always seen that whatever the money you get from government, we need to multiply it. So for example, recently, to be very honest with you, a couple of weeks back, we are setting up a diagnostic innovation hub. Somebody gave a amount of, let's say, X amount, let's say 3 crores of rupees. We could multiply it to 15 crores before we start the incubation process. So why I'm saying incubator should have a business plan. Correct. Incubators should have a sustainability plan. That's what we have understood very early stage of establishment, and that's why you could do it. And today you'll be very happy, sir. We have 250 odd companies which we have incubated. Of course, I think 70, 75 have failed. And I should not say they have failed, they have learned new things out of it, and they're going for
Correct.
the next one. But at least I could see 25 investable companies we could produce. And one company became now 4,000 crores company that's called Far Eye Technology. So we have been preaching and practicing authentic incubation. For me, it means you pick up innovators, one or two team members, build them through a process, and then this will become enterprise. Not like bringing enterprise to build one enterprise. That is happening in many parts like Hyderabad, Bangalore, and Pune. But Odisha have been a very, very new for this incubation process. We wanted to build this authentic process here. And that's how we have several ecosystem partners. We have nearby medical college, for example, you have from Sankar Netralaya, we have LV Prasad here, AIMS here. We could pick up clinical partners. So you have called a clinicians peer support program called CPSP program. We want to build those team ambience around us. And that's why today, we've been quite successful and our capex is low. We don't want to build only infrastructure. We want to build more content inside the processes inside the
Wonderful.
incubation. Regulatory, tech transfer, IP cell. We have all in between inside the incubation ecosystem, which is not, I think, happening in most of the incubator in the country. That's why probably we are partly successful, but in next 5 years, you will hear a lot of great things from us.
Great to hear, sir. Now, what does pandemic mean to you from your day-to-day business or operations, and how does you use technology to change it? And do you see any reservations in using a startup to help you out in some of your common problems that you face on a day-to-day basis?
Perfect. Thank you so much for giving me this opportunity to take this discussion. And I'm glad that I'm a part of this forum called the TechBharat. And this is my first such association with this forum. And looking forward for contributing some insightful information to this audience who are going to be a part of this from a practitioner's viewpoint. Coming to the question that you asked me about how the pandemic impacted us in terms of business, all hospitals were divided into two groups. One of the groups who were willing to take up the challenge, try to educate themselves and try to bring in certain modifications within their work ambience and their workforce, and take this dreaded disease head on and offer a support to the general public at large and to the government also to handle this COVID group of patients. The second set of hospitals and practitioners were those who did not want to participate in this particular pandemic, treatment of the pandemic, offering health support to the given patients because of various reasons. Their personal health could be at stake, their family pressures and peer pressures could be the second thing, the infrastructure challenges could be the other component, and then the support system that they had could have probably been the reason for them not to participate in this particular pandemic scenario. Fortunately, we belong to the first group where we went and took this entire challenge that is thrown to us, which is probably seen once in a lifetime, and probably we were lucky enough to survive that, and probably we would be fortunate enough to tell the story to our great grandchildren in the years ahead. And that's probably what this pandemic threw at us. The positive aspect of this entire thing was how it enabled us to lap up technology and take this technology in our regular day-to-day practices, which helped us face this given situation. And that's what gave birth to teleconsultations in our hospital platform. That is what gave us access to remote monitoring of patients at multiple places who are home quarantined. These minimal innovations that were there helped us to scale us and become one of the go-to providers in private healthcare for the treatment of pandemic cases in our hospital is concerned. So this gave us enormous amount of inflows, in terms of patients, revenue, and an opportunity. And that's what set us different from our co-competitors and others in the market. That's where I would address this situation presently, Chandramouli.
I think we have a wonderful example to discuss now. Actually, let me switch over to Vijay. I think knowing Vijay, I think I've been involved with Vijay for now a few years. And Vijay, looking at what we have discussed and what I know you have been a very successful entrepreneur. You made a couple of exits. You ran a few companies, and now we are running two more innovative health tech startups. So what do you see as a change over the years? I think we just heard Dr. Mrityunjay speaking about his experience in the incubation. Do you really see those things happening as far as an entrepreneur, or what do you do? Because it's pretty exciting to hear from you.
Sure. Actually, thanks, Chandramouli, to bring me in, and thanks, TechBharat. And I'm so happy to get introduced to Dr. Mrityunjay, to know that they are doing such a wonderful job and a very inspiring one. And I'm in healthcare industry for 32 years, and this is my third venture with which I'm just moving on. A lot of learnings because earlier what we think about enterprise is completely different from what we think about enterprises today. Like 95 was the first startup which I started, and 2001 was my second one. The 2014 is my third one right now. And like ancillary companies are there, but this is my predominant prominent companies. And the concept, I'm not getting into technology. A lot of people do talk about technology, how it has come, and then how future is going to be. I'm not going to talk much about it. What I think I need to talk about this time is healthcare is a little different from other industries. And I'll also explain how. And what are all the mistakes people do, and how I see that it need not be done that way. One of the infamous company Theranos, Theranos, because maybe the concept, I don't know whether it is right or wrong, but the concept might have been right. But then they started publicizing and then putting themselves in forefront much ahead of the product getting validated and verified by the healthcare professionals. See, there is a huge difference between technologists like us and the healthcare professionals like our practitioners, doctors. The way we do think is completely different. Because as a technologist, we think that we make one or two things right, and then we think that the 100th guy also will be able to use the same technology and then get benefited out of it. A doctor doesn't think that way. Well, the one question he keeps asking about is, will the 100th person also get the same kind of this thing? If there are any probabilities or then risks involved, I don't want to even start with the first guy. So this is how the language difference is, and then maybe they are not so expressive or simplified as I am telling, but a lot of time they try to mean this. We don't, as a technologist, try to understand. Instead, we tell that the doctors don't adapt to the technology that easily upfront. And they're not coming. They're not forthcoming. They do use the mobile phones. They do use laptops. They do use WhatsApp or Facebook or other kind of apps. So they know how to use it. And only thing is, when we tell that using this as another tool to solve your problem is becoming a big question. So what I'm trying to tell is, when I started in 95 and 2001, when my first ventures, we were very clear about how to go in a stage by stage. And Dr. Mrityunjay said that our startups need to be judicious in using the money. It means with minimum investment, we should be able to make. At least we are in India, we need to think like that. We are not in US where we can, or some other industry where we have so much of money, and without any hesitation, we will be able to spend any amount of money. So that's not the case in India. And then healthcare is another area. A lot of people, even investors, used to come and ask me, oh, what are you doing? What is the traction? How does it? So then I tell them that we are in healthcare. Healthcare takes time. We need to prove to people before we even take it to the market. I'm sure Dr. Mrityunjay also will have experienced the same thing in his own venture. So many companies, what they do, even before they get the product out, they start putting their website, they start going on marketing, investing, and they think that number of people whom they pay money and then acquire is the way to get the payment, way to get the customers. And that is how the market is going to expand now and for the future. So that is what is, no, that need not be the right way. And that is a wrong way to do, at least in India. That's what I feel. Even today, none of the aggregator companies or e-com companies or even marketing, they have not seen profit and how long they can sustain. They also have got a bigger questions. Just because in Tamil they say that someone has catched the tail of a tiger, then he can neither he can run with the tiger and hold it, or neither he can leave it. So that is the kind of a situation most of the companies or the tech companies have got into. Even in US, they don't know how to run, and that is the reality. Just because some few companies have made it to show that at least the project or create a perception that they're $1 billion company, it doesn't mean that we need to take that path, and we need to judiciously spend the money, either it is our own money or investor money. If we can get that particular thing right, I think we will have a good thing. And I also wanted to tell about government. Government has done a great job with these years. It was not the case earlier years. And I was called for one of the government program where I had to talk to all these entrepreneurs, so-called entrepreneurs. So I had to talk to them to inspire them and then give them some kind of an advice. But even government has not got the clarity right, because there is a huge difference between entrepreneurship and businessman. So I saw more a businessman there who are trying to exploit the benefits of the government provisions and then the facilities, rather than entrepreneurship really getting it. So as entrepreneurs, we need to think of new things. We need to bring kind of a challenging new kind of validation and verification into the market. Yes, we do have a lot of challenges, and these kind of a support system by government and incubator centers and all those things is meant only for that purpose, and that is not for businessmen, and that need to be understood by the vertical. And that is a really pathetic thing which I'm seeing through in various stages. So that distinction has to come in, and only then more kind of an entrepreneurship will be able to flourish. And that is what we need, and disruptive innovation is what we need if we have to become a true really India. I'm talking about India. If we have to become really a superpower, and we have a long way to go, and the real what do you call future lies in the hands of the entrepreneurs. Thanks.
Wonderful. I think you said it right, because I really like the idea of catching the tiger. So we wanted to hear from Dr. Mrityunjay what the tiger is going to look like. Now, is it can be tamed, or in terms of ideas, it can be tamed in terms of some new innovations, or it's going to be very wild, because the pandemic has taught us a lot of things which had been pretty wild actually. So how does the tiger look like in a lab, and how does it look like in the field, which we'll talk about it with Vijay. I think he tamed the tiger to some extent, which I know. But let me look at it from a tiger from a lab perspective. How does it really come from a lab?
Thank you. I think, let me tell you, so you don't have to hold a catch hold of a tiger, because start very humble way. I'll give you examples. For example, as Mr. Vijay mentioned, there's no clarity from government side. But I don't agree to this, because governments should not have maximum clarity. They should have some sort of, otherwise things will be difficult for startups. Now, regarding funding wise, everything is available in the country now. Starting from a fellowship, if I'm a BTech graduate, I want to start a company, I get fellowship from 30,000 to 15,000 per month. It means I'm talking about the enabling platforms which government is providing today. Any part of the country now, it's going to Northeast or be in Bangalore or in Hyderabad, things are not different at all. Now, who is driving is more important. Who is setting up the ecosystem is more important. It's not about only institutions like IITs. It could be a very interesting institutions. A college from Coimbatore might come up as a superpower in that ecosystem. So government is trying to map those things and providing all ample amount of grant. And Mr. Vijay said, in India, let's say we cannot afford to spend more money to develop it. Sir, let me tell you, Whatever the money you spend, no problem, but you must develop an interesting one, which has got scalability, affordability, accessibility concept as per the business language. Now, money is not a problem in our country. It might be now problem in US, but not in India. Being an incubation head, the last 10 years, I have realized, oh my God, so much of funding available. If you are smart enough, you can build your enterprise, 100 crores turnover with government's grant schemes. Of course, you need to raise follow-on investment, from the other private equity fund. But initially, when your risk zone was happening, is there, you will take up grant money. Today, government is giving grant of 2 crores of rupees, 3 crores of rupees grant. This was not happening earlier. I could give you a couple of examples like Tide scheme of Minister of IT Electronics called MEITI, the BIG scheme. Today now we're going on the 17th call going on BIG scheme in the country. Oh my God, I think there will be 80, 90 awardees getting each one of them 50 lakhs of rupees all across the country. You have got Nidhi scheme. Nidhi scheme also from DST has gone up to really threefold increase. A lot of coming the funding coming into the system. You have got IDEX program. People don't talk about it, but the Defense Excellence Program, they also start off getting money. Look at the petroleum industries, Bharat Petroleum, Indian Oil Company, IOCL. They're all putting 1-2 CR rupees to startup companies. They grant money also sometimes. So what I'm saying, money is not a problem. What the tigers should look like. So you should bring up some concept with a team approach, with a sensible humbleness approach. Problem statement, the clarity is not there. Much of the startup companies, incubators also facing same problem. Even incubation managers, they don't have clarity what incubators should be. They think it's a more of a building infrastructure, instruments should be there, and there'll be some managers to run a real estate business with a technical mindset. No, it's not true. You need to build up a business plan, where to get money, how to multiply. Let me tell you the journey of KTBI. 2009, we approached, got little money from DST, and today my annual expenditure of KTBI is close to 7 crore. I am within an ecosystem of university. I'm not a profitable one. So 7 crores I'm able to spend annually. I don't think this is less than a small startup company. So these 7 crores today, the government is not giving, I am sustainable. It means my incomes are more than that. And I'm really at the moment, doing good in from KTBA perspective. So how this is happening? So you need to look at incubation. Earning should not be only from rentals or mentorship fee or something. There are many more, 10 more key points which might bring business for the startups, and you have to think beyond it. So for that, I think there are a lot of schemes available, seed fund, leap fund, you name any fund, all exist in Indian continent at the moment. However, the couple of things for the incubators manager or startups, that do not run after money. If you have a right problem statement, you've done enough mapping exercises of market, of the technology, including freedom to operate analysis. FTO analysis, 99% startups who comes to incubator fails because they don't understand how to do FTO search, how incubator brings those enabling platform. So I'll be very happy to tell you to all the people here that KTBI sitting in Bhubaneswar as an IP platform, as a technology transfer platform, as a regulatory clinic platform, we bring those enabling concepts before we take up anybody as an incubator. The beginning has to be difficult. Then only your future journey is going to be much more better. I'm not saying easy, but much more better. So many cases, startups knowingly they fail if they really look for tiger. They have to really look for something which is a humble beginning, built it with the right mindset, right kind of energy, and they see the vision plan of what is going to happen in next 5 and 10 years. And I know it takes time. How do you bring, different platforms into pictures, which will lower down the timing? For example, today we have a company called Ezrex. Ezrex is a very one-man company who came with the idea. We gave him a little fund from Prayas grant of Nidhi Prayas of DST, only 10 lakhs rupees. Then the guy built in our Fabula facilities. Then he went to the hospital, so he brought in clinical partner. Then they did some trial, it didn't work out, came back, talked to electronics engineer, so bring mentors pull into board. Then we got regulatory people into board. So non-invasive, a panel, what you call device, which can look at creatinine, bilirubin, oxygen saturation, hemoglobin in a very 10 seconds of time, which is non-invasive. Now, he got traction, as Mr. Vijay said, what is the traction? So he got traction. The government, the two state government is now working, good amount of money flowing, private investment came into picture. Infosys Foundation came into picture. Now it's scaling up in terms of 1,000, 2,000 devices to be deployed. Now, this is what I call, you don't have to look for a bigger tiger at the moment. Look for a little egg from where you can hatch into a bigger and better bird afterwards. So incubators should play a major role, and KTB has been doing that. We brought a clarity into our ecosystem saying that incubator cannot be a project. They're only taking money from government. And then once government stops giving you money, you are dead or you run away. Now we said, even the government may not give money, we should be more and more profitable. And thanks to all my agencies like the DST, the BIRAG, the Startup Odisha, the DBT, MSME, I think all of them and really put money. And recently, we're the only player from a city cluster. I think so for the knowledge of the audience, I can tell you there are 6 city clusters have come up at the moment by the PSA office of the Prime Minister Government of Prime Minister of India. And this city cluster is in now Hyderabad, Bangalore, Pune, and also in Bhubaneswar. Bhubaneswar is led by the incubator called KTBI. And we are now driving bringing industry on board, setting up a manufacturing hub with the help of state government, corporates partner, and the central government. I think incubators should play bigger role than only incubating small startups. They also should work with the state government to bring manufacturing entities next to the incubators or in the city. So when they build a proof of concept and validate, where do you go? They're all running to Hyderabad or to Bangalore. We don't want that, right? They have to really grow in our cities too. They might go to Bangalore, but they have to also go here. So building enabling ecosystems should be the primary role of incubator, not only incubating few startup companies. So I think don't look for a tiger, just take a little egg and start working on it. Give enough nourishment, mentorships, all sort of nutrition. See that it's going to be a better bird in future. Thank you.
Absolutely. Great. I think that's pretty inspiring, sir. Actually, I just wanted to really, pick up where you left, actually. I think Vijay is just hatched a few eggs, which is already scaling up. I think we just wanted to hear his success story on scaling up those little ideas that he is working on, which is also run with an incubator from IIT Madras. Actually, he's on an incubator facility in IIT Madras, and with active support of IIT as well. I think there's a lot of technology gurus really backing him up. I think you said it right. I think there is a lot of energy which is required, and with a lot of other support and ecosystem support and things like that. Here's another great case study from a success story which is emanating from Chennai with Vijay, running something as unique as Helixon, which has been widely accepted in the industry, particularly post-COVID. I think we wanted to hear your pandemic story, Vijay. I think it's pretty exciting to hear that your heck is really ready for scale, actually.
Yeah. So we never anticipated COVID. Okay. So we were focusing upon something very simple. So my suggestion to any of the startups is, once you have identified your industry, start looking at the core issues within the industry. What is the core issue? And if the core issue is, can it be solved in a simple way? What is your new idea? And then will that bring some kind of a revenue? Or is there any sweet spot of saving money for the end user? So if we can identify that kind of an efficiency through which they can save money, the money saved, portion of it, not the full money, the portion of it can be shared with you. Especially in healthcare, that's more of a transaction. That's what it ends up to be, though it has to be more an emotional one. But unfortunately, I always see that even consumable goods are being transacted more emotionally than the healthcare products and goods or services. So this is what is the reality, but don't get carried away with other things. And where you wanted to show the efficiency there, this is the core things. But we saw that the accessibility is the bigger issue. Before COVID itself, we saw that accessibility within the healthcare is the biggest issue. And the only thing is through technology like internet and then a mobile phone is the thing which is going to bring this accessibility possibility. And if that comes, when we go and tell the doctor says, okay, that's all fine, but then where is the reliability? So a new factor has come in. So now how do we create an accessibility for the patients to get in touch with their doctors in no time or any time on demand? And how do we provide the same thing on the other side to the doctor in a reliable way? that makes things little complicated. So now we have to solve a bigger problem. And if it is only within the internet and then a mobile app, it's a lot more easier. But then when we bring reliability, then what happens is devices come in, like Dr. Mrityunjay said, non-invasive devices. These devices should be having medical grade quality. It should not be like a lot of even doctors ask me, Apple has come, Samsung has come, they have come, a lot of devices have come. And I'm not sure whether they will work or not. That's not my botheration. But my botheration is, are they medical grade quality product? Will a doctor be able to accept the results or measurements done by that? And will it be the medical grade quality? So that is the only question. If you know how to match with that thing, so just because you have made it doesn't mean that everyone has to accept it. In healthcare, you need to do clinical validation. You need to have certain set of doctors who are adopting it, and you need to show the result in line with the golden standards, the industry standards, in with which it has to comply with that. Only then what happens is they will be able to start, they'll even start to accept your solutions. So that's a long trial, long kind of means a long waiting period, and a lot of startups may not be having that stamina to stand by all these process. Very few get that thing, and that stamina or the financial support, and then they are, even if they have got the right idea, they need to sustain themselves to prove themselves over a period of time. Maybe like incubation centers like KTBI and other things, they must be doing a great job in understanding and picking up those kind of pearls on the way, and then ensuring that they are properly reinforced periodically to get that sustainability on that places. The idea may be great, the product may be great, the solution may be great. In healthcare, we have to expect a long sustainable period. We have to wait. The gestation period is very long here. So that is the first understanding I wanted to tell. If we can get that right, I think most of them will get. And secondly, the product reliability has to be in place. Focus upon core issues, show a value proposition to the end users, and convert it into a kind of realizable money part of it. And that is the kind of a value you need to bring in as a startup in healthcare industry, and you have to sustain that, anticipate that. You have to sustain more than, that's what even Dr. Mrityunjay told in between also. So more, you don't expect money from others. In spite of that, if you can generate enough revenue by yourself, and then you can sustain, nothing like that. And you can certainly reach $1 billion. This is my view. We are also heading towards that. And while we were doing all those things, COVID did happen. And then whatever we were talking for several years, now suddenly the industry started talking about it. The doctor is fearful of meeting a patient. And that is the most pathetic thing can happen at any point of time, unimaginable, even by a doctor by any means before COVID. And the patients were even refusing to come to hospital. So then we need a bridge between them, and technology was able to get into. And even then, a lot of doctors couldn't accept what we were talking about. And it took a while for them to even accept, and we are turning around the whole thing. So that is what we are, and that's what we are heading towards.
Brilliant. Thank you. Thank you so much, Vijay. See, as a practitioner, again, from an IT perspective at Shankara Nethralaya, this was also quite an experience for me personally to work on something very new, because I can share my perspective. Like in the last 5 years prior to the pandemic, to what we did in the pandemic times, I think we did more, definitely from a technology adoption perspective. And it was question is not about digital anymore. I think it's now a question is what do I do more? I think we learned a couple of new things, something like social distancing. I don't think that was a word that we ever understood before. Hygiene suddenly became a mainstream factor. From my perspective, definitely, we thought these are all things that how do I take these two words related to put a point of view from a technology perspective and try to do something different in terms of adoption, because something that you have been so full, because healthcare had always been high touch, in the sense that unless you touch and feel the patient, never ever you can do a business with anyone actually. suddenly this became remote, like what you said, virtual care or online teleconsultations, stuff like that. I think we even extended a few things, say like faceless. For example, can I use things like facial recognition to recognize patients or employees because of the pandemic and other things that we don't want to touch anyone. Now, how do I keep the social distancing away? Can I bring in more digital into the story and the things like that? I think some of those things which you have not done before. It's not that we didn't do before. Healthcare had typically been a laggard in terms of adoption of those technologies. So did you bring in any new innovations into your core businesses from that perspective, or you still think that some of the traditional stuff you would still continue beyond, because now that we're coming out of the pandemic in many ways, do you think that these are all going to be lasting and changing forever?
Yeah. So, the first part that you talked about related to how the healthcare institutions were ready to adopt this technology was one of the challenges. I've been in practice for the past close to almost around 25 years. We started this hospital 10 years ago. And the first thing that I invested in our hospital was a hospital management software. That's the first ever thing that I laid my hands on. And the amount of research that I did to try and choose and pick the best possible software that was available was my major investment. And I'm happy to say that that has paid me rich dividends 10 years down the line. Second, talking about the technology being adopted by regular practitioners, now, all that was a challenge over the last 10 years. When we offer this platform to our consultants and to our platform to our patients, what was posed as a probable challenge was easily scaled through by all my practitioners, and they started becoming comfortable using the electronic medical records, using the teleconsultation platform, making sure that they are comfortable with the patients with an audio video consultation platform being made available. And that is something that we were able to achieve, which was a challenge for close to almost around 4 or 5 years. We were able to achieve that in 1 to 2 months' time. So that's a remarkable impact of this technology, reaching the nook and corner of our patients at their doorstep, within their living rooms, the doctors giving their consultations within their living rooms. The second part that we talked about on what kind of a technology we implemented during this period, we used a lot of these IoTs, we used a lot of these wearables by the patient. So one of the critical things that we wanted to monitor in these patients was obviously the temperature. Then we talked about the oxygen saturation of individuals. Then we talked about their overall heart rate and blood pressure monitors. Now, what we did was we gave them these particular platforms and asked them to upload these records on a periodic basis, and we were monitoring them remotely. So there was a team of nurses and paramedical people who are monitoring this on a regular basis on a patient to patient. And the minute any of these reached a threshold beyond the range which was considered normal, that is when the consultants were called in for. And it became easy for us to do a triage, to categorize the patients as low risk, medium risk, and high risk. We were able to caution the patients at a much earlier stage to take precautions and get admitted to the hospitals at the smallest incidence of a high risk exposure. And we were able to save lives when they were admitted at a much earlier stage of onset of critical symptoms, like a drop in saturation, like a fluctuation in blood pressure, fluctuation in heart rate. And this was tremendously useful for us, putting this into general routine clinical practice. And that is what gave us an edge over our other competitors in the market, when we were able to utilize these variables in a regular practice. And that was something that was extremely useful and comfortable for the patients and for us as practitioners to implement this in a regular day-to-day practice.
Wonderful, wonderful. Actually, no, you touched upon a lot of good stuff, now, which are all domain of an innovation, which hasn't been done before, definitely. And with Bangalore, where you are in, I think, which has been the hub of all this innovation, startups and ecosystems and things like that, where do you see that these ecosystems being actively supported by somebody like you or your hospital? Now, how do you want to take this far? Because one of the biggest challenge in a healthcare setup is qualified data, actually. I think that's kind of a, we may have the best of the technology. As a practitioner of technology, definitely I can say we can really come out with something wonderful from a tech standpoint. But in a healthcare, for us to really validate, you would need a lot of good data that which can test these devices. Now, you touched upon a lot of hard buttons on the devices. So how do you really support them? Are you passionate about any of these supporting the startups, or do you have any innovation center which can support them? How is it like?
Right. So what I've tried to do is in the interim part, I try to kind of look into what is the futuristic medicine that we are looking at in the probably in the next 5 to 10 years time. And I've done a little amount of research, and I try to give a certain weightage based on how close it is to become real in the near future, what kind of an impact this particular innovation, technology, advancement, or any of those things is going to have on our treatment results, and how is it going to affect our outcome of the patients. And the third thing that I looked into as one of the metrics was how accessible is this particular technology going to be to our given patients. Based on these three parameters on how close it is to going to become real, how impactful it is going to be for us as general practitioners, and how accessible it is going to become available to our general patients in our set of the people and our crowd, I divided the technologies into three topmost areas where we are going to look and focus on. The top three that came out on the research that I did on how we could probably have this was, the first thing that scored was the health sensors and telehealth. This is one technology that is going to be extremely impactful, accessible, and already a reality to a very large extent. So any of those tech startups that are working on this, we would love to associate with them and provide them the necessary kind of a medical support in terms of recruiting patients, in terms of doing the trials, in terms of proving a proof of concept, and making sure that we are able to guide them and give them the medical expertise and knowledge that is required in this particular field. The second thing is the area or the technology aspect that I would like to look in and support people are people who are focusing on consumer genetic testing, the direct consumer genetic testing. This I feel has got a massive impact, because here we are talking about prevention and we are not focusing on treatment. Now, the minute we change the entire course of our thought concept in trying to do a personalized medicine, a personalized diagnosis and treatment, this is going to become a game changer for us in diagnosing and treating disorders. So anything to do with direct to consumer genetic testing would have a huge impact, right from the neurological disorders to gastrointestinal disorders to the pulmonary disorders to a whole set of metabolic disorders and non-communicable disorders. These are going to be the chunk of the disorders that we're going to look at in the days ahead. And once we are able to impact this and get this diagnostics in a very personalized manner, this is going to give us tools to enable us to treat them in a more effective manner. The third technology that is going to come up is artificial intelligence. The amount of data that is going to be mined by using all these variables that are there and how that is going to impact is something that each and every healthcare institution would want to use this for their benefit. It can be for their business benefit, it can be for their consumer benefit, it can be for the overall patient benefit. In the order of preference, they would be 5G, where we are talking about an iKnife tool, which is probably developed by the Imperial School of London, where they're using this knife in general surgery, in cancer surgeries, to minimize the area of a regrowth of cancerous tissue. So you will be as precise and as close to possible, where you're able to knock off the cancerous tissue and leave the normal tissue knocked off during the surgery. So that is something that is going to happen. We are talking about robotics, the medical and surgical robotics that are going to be used in a regular practice, doing all the regular mundane stuff, assign it to these robots and use the manpower who can usually be more effective in utilizing them. 3D printing is the other thing that we are looking at. When talking about 3D printing, it could be in terms of prosthesis, it could be in terms of implants, it could be in terms of salvageable organs, in terms of 3D printing drugs. These are all the various other areas that I feel where we could look at the tech startups focusing and have a real impact in our medical practice.
Wonderful, wonderful. Actually, just for your information, I think at TechBharat, there is also a focus towards getting the startups grounded to running their campaigns. And I think we are also trying to help them to raise funds and things like that. I think some of these areas that you talked about, I think there are a lot of innovators who has great ideas, but they have no idea about how to take it further. I think we can channelize some of those things to you to see how does that benefit humanity? Because one of our goals is to see that we can create some intellectual property from India and this scales up to the world actually, because medicine is a universal idea. There's nothing Indian about it actually.
Right.
We can do it more effectively out of India. I think you have given us some wonderful insights. But like any startup, I think that we have our usual challenges as well. It could be people, it could be ideas, it could be technology, or adoption or data and things like that. I think there are multiple things, particularly from a health perspective. So from your thought process, you have been in the business for quite some time, you know what is changing. And post-pandemic, I think the level of change is far too dramatic. It's no more decades now. I think it's all in months now. I think now what do you see as your top 3 challenges? And how do you want to navigate it?
So in terms of the challenges that we find in terms of what is happening right now, there are these 2 groups of people who are entirely working in 2 cocoons. It is for these 2 people to merge together. The tech people need to come onto the same platform as the healthcare practitioners and involve them right at the conceptual phase, at the idea phase itself, so that we are able to actually deal with real world problems. What an health tech guy would perceive as a problem may be different from what an health practitioner would visualize this as a problem. So one of the challenges that I would want these guys to overcome is involve the medical practitioners who are tech savvy, who are futuristic, involve them at the early phases itself, so that we are able to kind of narrow the growth curve, narrow that learning curve, and make sure that we are able to address the real world problems and make sure that that technology or innovation is going to have an impact on our medicine. Say, for example, I'm a diabetic patient. One of the challenges that I find in patients is getting the blood sugars done on a periodic basis. Now, when I have something like a Google Lens, which can probably get their blood sugars checked in their tears, it does not involve any invasiveness. That prick is taken off. And if I'm able to get this blood sugars sent to me on a periodic basis at different meals at different times of the day, it helps me to titrate their blood sugar levels and with appropriate medications accordingly. So these are the kind of technologies that I feel could probably be very, very useful and we need to focus on. The second challenge that I see is there is a lot of gap between what is being talked about and what is actually being implemented. So we need to bring that into reality and say, am I talking about something which is going to be realistic, which I'm going to talk about this? Now we know that the teleconsultations, the telemedicine, all these things have all become a reality. Now that is obviously going to take a major chunk of the load that is going to be there. So any technology needs to be implementable, needs to be applicable, and needs to be accessible. Now anything which is extremely costly is not going to be adopted by the general practitioners. So that's the second challenge that I want people to overcome. Make a technology accessible, affordable, and easily implementable. And once you are doing that, then things becomes easy for us.
Dr. Brith, I think we may be running short of time. I think if we can quickly summarize your top 3 challenges, Dr. Mrityunjay, I think that will be useful so that now we can learn from your experience. And similarly, I may ask Vijay to sum up his top 3 challenges, running an enterprise and a very innovative enterprise. Yeah, Dr. Mrityunjay.
Yeah, good. So very brief, as I said, so the new learnings from COVID is a positive also. Look at what policymakers, government, startups, corporates all came, institution with a good interest, with a good intention. Now things are happening, manufacturing scaled up in all sectors. Now, 3 challenges incubators facing, especially on the health tech sector, even including startups. Now, one is, for the trials and for the validation. Where do you go? The test beds are very few. Like if I go for I cannot go to always to Sankan Nethralaya. So how do you build that ecosystems with partners like incubators? If startups are becoming better and better, how do the clinical partners they can onboard and can work with the startup? So there's one big challenge I feel. Then bringing processes. For example, I have more than, I think KTV has more than 20 plus medtech startups. And then if you look at few of them, of course, they're doing good, they're raising money and all. That is not for me, that is not success. Success is, they are jumping every time from TRLs level, from the BRLs level. So if I look at the processes from the regulatory perspective is not clear many times. It is the documents are going back and forth, and the startup is really very disturbed because he says that I'm putting money, but things are not happening because he doesn't have much of oxygen of money. So he has to really see if I'm sending something, clarity, and I should get some approval or some points. So the clarity in the regulatory processes are not there many cases. So what we have brought in a concept called setting up a regulatory clinic for startups. So that is also important, and that's I think is and connecting to the government. So who are the potential buyer? If you look at now many of these sectors, of course, those who are B2C, they sometimes to the government, and governments also should pick up. Let's say my state has got startup. What is industry department, MSME health department? This should, I was just discussing with the former chief secretary a couple of weeks back. Would you build a platform like this where we have been facing challenges? Can we onboard our startup and your team selects and do the piloting at your like PSCs and CSCs? If it is going great, startup gets a lot of boost out of it. So as an incubator, we feel so many, we get so many challenges. But of course, KTBI is always try to bring new processes, new thoughts. We want to always, don't complain about it. We always try to build solution out, because this is how the system is. You cannot complain about it. But if there are challenges you talk about, I'll talk about the trial validation part of it, the bigger challenge, because people are building and building and building in the laboratories. However, the device is not being validated in different cohort studies. Now, bringing processes like regulatory and the licensing, those kind of concept, and connecting to the government or the clients, the authentic clients for piloting. If these things are done, I think the medtech, the health tech kind of companies, the development to realization will, I think, lower down some of the timings part of it.
Thank you, sir. Thank you so much. Yeah, Vijay.
So I do really agree with Dr. Mrityunjay, and then I see these days some of the hospitals coming together and then putting forth their technological requirements in place. Maybe I will privately share those links with you, so maybe that can help some of the startups to think about that, and that can enable startup to tweak their products a little bit so that they can see how they can midway come between the customer demand and then put their particular solution in place. So that's one. So in my view, the biggest challenge right now we are facing is, we were facing and we are again facing again is, so we were heading towards a certain direction before COVID. And the COVID came, the entire thing started moved away, and then things, the business plan, or especially not the product line, the business plan completely changed. And the COVID has changed. Now the post-COVID era has come. Now we need to reinvent the business plan. So that is the another challenge. So this is a kind of a strain which we have got right now. So we have to, within a year and a half or so, we have to now change 3 times the business model. And such a dynamism is what is expected out of all the startups. If they can start thinking about this kind of change, anticipate and then keep changing. And what has happened during this COVID is a lot of these so-so guys have all vanished. And only the companies who have strong fundamentals, and then who have the ability to sustain themselves, are able to survive during this period, even in healthcare. Because we can tell that a lot of things are happening positively. No, it's not. We have a lot of challenge even in healthcare, because a lot of companies, even in healthcare, have booked losses during this period, including pharma companies. That's the reality. So you have to survive during this period. You have to be very strong in your fundamentals, and ultra focused effort is required. But at the same time, dynamism to change according to the market need and the business models wise, especially business model wise. We are strong that way. I think we can sustain, and then we will be able to see the future. And also this COVID will bring a lot of new players in, because the game has changed, and some of them will come and then go. So I have seen a lot of companies who have come during the COVID. They are no more there in the market, but they did make a lot of noise. And we have to be loud enough so that our point and then our ideas are much better heard than those noise creating people. So they will sustain. For some time they will be there, and they are not, because their fundamentals are not strong. Because their fundamentals are not strong, they are not going to sustain for a longer period. So this is what is my 2 cents for the end.
Oh, thank you. Thank you so much. See, as a provider, I can definitely see what you're saying as resonating to what we hear daily and what we do daily, actually. If I can take a look at as a provider, the biggest driver for our change is always cost. So we count every penny that we can potentially think, we squeeze every processes that we can think. Almost can we do even that 1 paise saving in that SMS is what we look at it. I think cost is key driver. Actually, any technology adoption that we are trying to look at should address cost. I think both of you really articulated that as one of your key drivers. Second thing is, we all know that technology can really do many things, but the bottom line is health is quality centric, actually. So the quality, does it improve quality of service, quality of life, quality of whatever we try to do? I think that's important. So just because somebody had got a great technology, we really don't care. But I think end of the day, we really see whether it makes any sense to a provider to our patients. I think that's what we really look into it. And and a key stakeholder in all this process is always the patient. So patient safety is our biggest concern. So when we look at almost everything, the reason why technology adoption in healthcare typically before COVID has been very I would definitely say it's not the primary requirement for you to be on a cutting edge, is because they are always worried about the patient safety. Does it change anything from a perspective of the patient safety? I think these are things that we constantly look at it, but COVID thankfully had changed many of these and put some caution out of the wind. We see a lot of new technologies coming around. I think that's where your work on incubation as an incubator is helping newer stuff, and particularly somebody like innovators like Vijay coming into doing new things is getting some great attention by almost everyone, actually. Thank you so much. I think it has been a wonderful talking to both of you. Hopefully, we'll take some questions at the end of the day from the audience, and we'll try to answer it. Thank you so much. Vijay.
Thank you. Thank you.
If you have anything to really talk about, I think you can add. Thanks. Yeah.
Okay. Thanks a lot. Thank you.
Thank you so much. Thank you so much. Bye-bye.
Thank you.